Good morning, viewer. Welcome to our FTV. Viewers, widely used GLP-1 drugs, including Ozempic and Mounjaro, may carry an unexpected downside, a small but measurable increase in hair loss. For the same, a large study of adults with type 2 diabetes found that people taking the medications were more likely to develop alopecia than those using two other classes of diabetes drugs. The findings published in the BMJ do not prove that GLP-1 receptor agonists directly cause hair losses, but they provide some of the strongest evidence so far that the association deserves greater attention as drugs such as semaglutide and tirzepatide becomes increasingly common. Because researchers stressed that the absolute risk was low, even so, information about a potential effect on hair could matter to patients when they weigh the benefits and drawbacks of treatment with their clinicians. Because alopecia. Alopecia has previously appeared in individual reports and safety monitoring data involving GLP-1 receptor agonists, particularly semaglutide and tirzepatide. Until now, however, researchers have had limited evidence showing how the risk compares with that of other diabetes medication. So, to investigate, the team analyzed electronic health records from the University of Pennsylvania Health System, and thus a study included adults with type 2 diabetes who began treatment with a GLP-1 receptor agonist and SGLT2 inhibitor or a DPP4 inhibitor between January 2009 and September 2024. One analysis compared 12,004 GLP-1 user with 15,221 people asking SGLT2 inhibitors. A second included 11,964 GLP-1 user and 11,230 people taking DPP-4 inhibitors. The research compared diabetes drugs. The groups differed in several important ways compared with SGLT2 inhibitor users. Those taking GLP-1 drugs were younger, mean age 58 versus 65, had a higher body mass index 36.2 versus 32.3, and had lower rates of cardiovascular disease and chronic kidney disease. Viewers, similar differences appeared in the second comparison. GLP-1 users were younger, mean age 58 versus 67, and had a higher body mass index 36.2 versus 31.3 than people taking DPP-4 inhibitors. Researchers used statistical methods to account for age, sex, ethnicity, pre-existing conditions, body mass index, other medications, and additional factors that might influence hair loss. After those adjustments, GLP-1 receptor agonists were associated with a 37% higher risk of alopecia than SGLT2 inhibitors. The recorded rates were 6.91 versus 5.04 cases per 1,000 person per year. Behind the exclusive report.